Alrighty, hey guys. Pretty much today what I'll be doing is going over asthma. So asthma, everyone knows what asthma is. People like to lie and say they have asthma. People be saying, "Oh, I got asthma, so I can't run." But let me actually tell you what asthma do. So asthma pretty much is clogged slash bronchioconstricted. Um, it's constrictions to the bronchioles and the bronchi. And for the nursing students, or for my nursing students out there, you want to know that this can lead to acidosis due to the increase of CO2 in the body. Why? Because if things are constricted in the bronchioles in our airway, or even if it's clogged, we're holding in too much more carbon dioxide than we usually need, and we're not taking in, we're not taking in too much oxygen that we need. So that's kind of a summary for the definition of asthma. So pretty much some things to diagnose yourself or how to know if you have asthma. You can take a pulmonary function test, right? So typically what that looks like for people is when they go to the doctor or any facility and they sit down and they do a series of tests where they can like breathe in really fast, in and out, and then they're gonna tell them, all right, breathe out all the air you can to test the lung capacity, and they're gonna say, taking a huge deep breath, so hold it, hold it, hold it. And when they say breathe out, you gotta push out to the hardest you can. Okay, so that's kind of what it looks like. So you're doing a series of tests of breathing in and out to test your lung capacity, whether or not if you have asthma. Now, this isn't really I personally don't think this is a strong determining factor of having asthma, because one day, it's a test, so you can do so bad on the test and you don't have asthma, but you can do so good on the test and you probably have asthma. So, and then you can also do chest x-ray. It's a chest x-ray. And then you can also do a thing called a peak flow meter. And this is typically for people who still has asthma, where they sit down, sit up straight, and they do the same thing. They take in a whole lot of air and they exhale very forcibly until they can't no more, and they look at their highest reading. All right, so people that has asthma and what it might look like for an asthma attack. So there's a mnemonic called asthma that I got from Simple Nursing. So people can have accessory muscle use. So, they can really their body can try to compensate for why they're having trouble breathing. So they have accessory muscle use, other known as restless. They have shortness of breath, right? So they have shortness of breath, not bradypnea, but dyspnea. Okay, so shortness of breath. They have tight chest and tachypnea. And the only reason why it makes so much sense is because when your body's trying to compensate and get air, you're hyperventilating, tachypnea, but you're not taking in as much oxygen than you need. So now your body is still having CO2 inside of it, which is leading you to have dyspnea, because you're having difficulty breathing properly due to your tachypnea and shortness of breath and other sort. And if you were to listen to someone's lungs and hear what their lung sounds like, you hear high-pitched wheezing, so that the whistle sound like that. They have minimal breath sounds, so it sounds very shallow, or you can't really hear. It sounds like very shallow wheezing. And then sometimes they can have absent breath sounds, which is very priority. If that person has absent breath sounds, do not take the time to sit there and auscultate. Take the time to go get help, get the rapid response team, and get the provider. And then why? Because they're in an acidotic state and they have air trapping, which is prolonged exhalation. So they're breathing out too much CO2 and they're barely taking in any O2 at all. All right, so some ABG things to talk about as well is, so we know that the pH would be less than the normal, so 7.35 or 36 according to ATI, and then the CO2 would be greater than 45. Remember, they're in acidosis, so if they have an increase in CO2, they're acidic. And then their PaO2, which is just the oxygen, they'll be hypoxic, so it would be less than 80 out of, I think, 100. So it would be very less than 80, and they can present with agitation, restlessness, remember, restlessness, and drowsiness. And then some things for acute asthma attacks that you want to also look out for. So there's early signs and late signs. So early signs, think of respiratory alkalosis, hyperventilation. So what during that they have, right, when people are hyperventilating, they can have they're panting like a dog, so they can have an increase of oxygen, so they can start feeling lightheaded and all those type of things because they have too much oxygen. And then late signs will be respiratory acidosis, because they're retaining the CO2 now. So think of it as you're having an early sign of asthma attack. You're taking in so much, breathing in and out, hyperventilating, and then boom, like, oh my gosh, it can't get out. So now I can't get any more back in. So now I'm just retaining so much CO2 in my body, and I'm having hypoventilation and slower respirations. All right, some other complications would be, they can be hypercapnic, which is hyper CO2. So they're very acidic during these stages. And then for an emergency response, right? So I'm gonna tell you for what it says in Simple Nursing, and I'm gonna tell you what it says in the ATI book. Is status asthmaticus. This is something that albuterol can't even fix, no nothing, right? So it's a life-threatening episode of airway obstruction that is often unresponsive to common treatment. So you can't give people albuterol, cimeterol, anticholinergics. You can't give them ipratropium. Like you have to get them an emergency intubation, which will most likely be an endotracheal tube or endotracheal intubation, and you can also administer IV fluids, oxygen, bronchodilators, and epinephrine to initiate the steroid therapy or to get them back up with things. So that's for status asthmaticus. So that's kind of like a general, but now we're gonna move over here. Okay, let's see. Let's get this straightened out. All right, I think you can see that. All right, so medications, right? So we already learned in pharm for the medications. We know bronchodilators, right? So we have short-acting bronchio something. It's just short-acting. So with short-acting, we have albuterol. We know albuterol is one of the first-hand treatments for asthma attacks and stuff. But albuterol also you want to check for tremors, like they can have shaking and tachycardia, because it's kind of like stimulating that effect. Then anticholinergic effects or medications, you can give them ipratropium. You want to remember dry mouths, because everything's so dry. They're on the go. Everything's just up. So you want to watch for dry mouth, and you want to also have them suck on hard candies and increase fluid intake. And they should report a headache and monitor for the heart rate because it's an anticholinergic. And then methylxanthines, or I don't think people really pronounce it with the meth thing, but theophylline is what a lot of people know. So you want to monitor for blood levels for toxicity, because that drug can be very toxic to the blood. And then the long-acting, I think it's long-acting beta agonist or antagonist, one of the two, is salmeterol, whatever it's called, salmeterol, and it's used to prevent asthma attacks. So that this is long acting. This is something they're going to be taking, like on a regimen or whatnot, so it can prevent asthma attacks. And then for theophylline, the adverse effects would be tachycardia, nausea, and diarrhea. Yeah, and then some anti-inflammatory agents. So we know corticosteroids; those are usually to help us dry out those secretions and stuff. So we have fluticasone and prednisone, right? Then we have leukotriene antagonists. So people use that for like montelukast. A lot of people use that for like allergies when they have like a lot of, sneezing and asthma and stuff. Then they have mast cell stabilizers, also known as cromolyn, and then monoclonal antibodies which is also called omalizumab. I don't even think we're going to be tested on that, but that's just something. So with the anti-inflammatory agents, you want to watch for hyperglycemia, you want to observe for fluid retention, and you want to monitor for throat and mouth sores. They're in the book, it's called like aphthous sores or something, which is also known as canker sores. So other than that, time for questions. Okay. Hopefully y'all can see that. Shoot. Okay, y'all should be able to. Alrighty. I already took the quiz, so I won't really answer it. Let me refresh it real quick.
Asthma is a chronic.
All right. So take some time to pause it so you guys can read it and then choose your answer and we'll go for it. So the nurse is educating a client with asthma about the use of a peak flow meter. Which action is correct? A, the client obtains 3 readings, averages them, and records a single score. B, the client performs each peak flow testing while lying on the left side. C, the client takes the peak flow meter vigorously for 2 minutes before testing. Or D, the client exhales in it quickly and forcefully as possible, then records the reading. All right? And so the answer is, have your answers in. The answer is D. Using the peak flow meter, after zeroing the device and positioning properly, the client should inhale, place the mouthpiece in the mouth and seal the lips, and exhale as quickly and forcefully as possible and record the reading. So remember, like I was saying, it's kind of like the PFT test, so you have to push out as forcefully and exhale as possible so that way you can see where you're at on your reading. All right, I won't read the answer choices, but the nurse is caring for a client who is experiencing an asthma attack. Which manifestations would the client most likely display? I'll give you guys 15 seconds to answer. You guys can pause at this too. All right, guys, so the answer is wheezing, accessory muscle use, and coughing. So you can pause it and then read the rationale for this as well. All right. The nurse is educating a client about triggers in asthma. Which statement indicates the client correctly understands the nursing teaching? I'll give you guys 10 seconds. All right, guys, so the answer is D. I should keep a journal to help better identify my triggers. Again, you guys can pause and look at the rationale. All right. Which best describes the pathophysiology of wheezes during an acute asthma attack? A, excess mucus production by goblet cells. B, B, airway inflammation and bronchoconstriction. C, decreased airway reactivity. Or sorry, that's C. And then D, rapid destruction of bronchial mucosa. I'll give you guys 10 seconds again. Alrighty guys, the answer is B, airway inflammation and bronchoconstriction. And then again, you guys can pause, read the rationales, and then we can move on. Here goes 1, 2. Alright guys, last question. The nurse is caring for a client who is experiencing an asthma attack with coughing and wheezing. The client becomes restless and diaphoretic, and the wheezing stops. Which action should the nurse take first? A, document the findings. B, auscultate the lungs. C, notify the healthcare provider. Or D, assess urine output. I'm gonna give you guys like 5 seconds. And the answer is notify the healthcare provider. Remember, like I was saying, if they stop breathing, rapid response team and get the healthcare provider immediately. And just like that, guys, thank you guys for watching my video on asthma. I hope it really helped, and I hope you guys really learned from it. And if you guys want me to make more videos like this, I would love to.